Hello, my name is Dr. Susan Blank, and I'm an endocrinologist who works with the Virginia Department of Health. Thank you for joining me for today's presentation, which is part of the Virginia Healthy Hearts Initiative. Our topic today is Be Heart Smart, how the cardiovascular system works and how to keep it healthy. Let's get started. We're going to start by talking about how the cardiovascular system works when it's healthy, then move on to talk about cardiovascular disease, cardiovascular risk factors, and some things we can do both individually and as a community to help prevent cardiovascular disease. So what makes up the cardiovascular system? I like to think of the cardiovascular system as a fancy plumbing system with a pump and some pipes. So the pump portion of the cardiovascular system is the heart, and you can see that right here in the middle of the chest. The pipes portion are the blood vessels, which you see here going throughout the body. They're the little red and blue lines, and there are three different kinds of blood vessels. They're the arteries, which bring blood away from the heart. They're shown here in red. They're the veins, which bring the blood back to the heart, which are shown here in blue. And then there are capillaries, which are teeny tiny little vessels around the width of a human hair, which connect the arteries to the veins. And what is the function of the cardiovascular system? The cardiovascular system works to pump blood throughout the body, and the blood delivers oxygen and nutrients to the tissues and removes carbon dioxide and waste products from the tissues. This is a picture of the heart, and as you can see, it's a little bit different than what you would see on a Valentine. This part down here is the main part of the heart muscle, and then attached to it you see a bunch of different blood vessels. The superior and inferior cava are the big veins that bring blood from the body back to the heart. The aorta is the big artery that takes blood away from the heart and delivers it to the rest of the body. And then the pulmonary arteries and veins take the blood to and from the lungs and back to the heart. And then these smaller vessels that you see here on the outside of the heart are coronary arteries. They're the vessels that are responsible for delivering blood to the heart muscle, and they're really important because if they get blocked, that is what causes a heart attack. Here's another view of the heart where the front has been removed so that we can look into the inside of the heart. And the heart is made up of 4 different chambers. At the top, you see the atria, which are the smaller chambers of the heart. This is where the blood flows into the heart. On the right atrium, it comes from the superior and inferior vena cava, bringing blood from the body. And on the left atria, it comes from the lungs via the pulmonary veins. And then at the bottom of the heart, you see the right and left ventricle. You can see that the muscle walls of the ventricles are a lot thicker, and that is because the ventricles are responsible for squeezing the blood out into the lungs and the rest of the body. You can also see that the ventricles are separated both from the atria and from the big blood vessels by valves, and those valves keep the blood flowing in only one direction. This picture shows the flow of the blood through the heart, and the parts that are shown in blue are carrying deoxygenated blood, while the parts that are shown in red are carrying oxygenated blood. So the blood starts its journey in the body. It comes through the superior and inferior vena cava back into the right atrium. From the right atrium, it gets pumped through the tricuspid valve into the right ventricle and then gets pumped out through the pulmonary arteries to the lungs. In the lungs, the blood gets oxygenated. It turns from blue to red. It returns through the pulmonary veins into the left atrium, goes through the mitral valve, and it gets pumped out from the left ventricle into the aorta, which is the big blood vessel which carries it to the arms and legs and brain and body. This view zooms out and shows how the whole system works together. So oxygenated blood leaves the left side of the heart and gets pumped out through the aorta, where it gets delivered to the brain, to organs, and to tissues throughout the body. In those tissues, it delivers the oxygen and becomes deoxygenated. It returns back through a network of veins and gets returned to the right atrium, goes through the right ventricle, and then out into the lungs, where it picks up oxygen, goes from blue to red, and then gets delivered back to the left side of the heart so it can begin the whole journey again. If we zoom in on the blood vessels, we can see that the red oxygenated blood comes through the big arteries and goes through smaller and smaller branching arteries until it gets to the point of those teeny tiny little capillaries that connect the arterial system and the venous system. In the process, they're going to deliver oxygen to the tissues, and so that's going to turn from red to blue. The blood is then going to get gathered in bigger and bigger veins until it reaches the inferior and superior vena cava, which are going to bring it back to the heart. And if we zoom in even more and take a cross-section of one of those blood vessels, you can see that it's just basically a nice, smooth, flexible tube with a wide open center that's allowing the blood to flow freely through the middle. These guys are the red blood cells. They're the ones that are actually carrying and delivering the oxygen. And then you can also see some white blood cells in there, and those are the infection-fighting cells. On top of being part of a fancy plumbing system, the heart also contains a fancy electrical system. And this electrical system is responsible for coordinating the beating of the heart. The electrical impulse begins at the top of the heart in the right atrium in a place called the sinoatrial node. That impulse is conducted through the atria walls, causing the atria to contract. It then travels to a part in the middle of the heart called the atrioventricular or AV node, and it's conducted from there throughout the walls of the ventricles, causing the ventricles to contract. And it's this electrical impulse traveling through the heart, which you see captured in an ECG or electrocardiogram tracing. Hopefully now you appreciate what a remarkable and sophisticated system the cardiovascular system is, and it works perfectly for us the vast majority of the time without us even having to think about it. Here are just a few amazing facts about the cardiovascular system. Your heart beats around 100,000 times daily, and it's adaptable, so it can beat faster or slower depending on what you're doing and what your body needs. Your body contains 60,000 miles of blood vessels, which is enough to circle the earth more than twice. And a red blood cell can make its path around the entire body in under 1 minute. Now that we've talked about how the cardiovascular system works when it's healthy, we're going to move on and talk about cardiovascular disease. Heart disease is a huge problem both in the United States and around the world. It is the #1 cause of death and disability in the United States and globally. 1.6 million Americans have a heart attack and stroke every year, and it accounts for 1 in 4 deaths in the United States. And on top of all the death and disability, it is also very expensive for our economy, costing around $418 billion annually. There are a few different types of heart disease. You can have trouble with the electrical system, you can have trouble with the pump, or you can have trouble with the pipes or the blood vessels. If you have trouble with the electrical system, that leads to a category of disease we call arrhythmias. This is when the heart beats too fast or too slow or starts skipping beats. And this can cause a lot of problems. It's why some people may end up needing a pacemaker or an implanted defibrillator to shock their heart back into a normal rhythm. If you have trouble with pump function, that leads to heart failure. If the heart isn't pumping well enough, you get a backup of blood and fluid behind the heart, and this can cause a shortness of breath if the fluid is accumulating in the lungs, or swelling if it's accumulating elsewhere in the body. And if you have trouble with narrowing of the blood vessels, that can lead to heart attacks and strokes. I want to talk a little bit more about atherosclerotic cardiovascular disease because it's the most common cause of cardiovascular disease, and it's also responsible for most heart attacks and strokes. This is caused by plaque buildup in artery walls, which leads to narrowing of the blood vessels and restriction of blood flow. And we can see that demonstrated here. In this blood vessel, it's a nice normal blood vessel, and you can see the blood is able to flow freely through the center of it. In this next version, you can start to see a little bit of buildup of plaque in the artery walls. The plaque is made up of cholesterol and some inflammatory cells. At this point, the blood can still flow pretty well. This next stage, we see even more buildup of the plaque in the blood vessel walls, and at this point, it's starting to compromise blood flow a little bit. This might be a stage where the person is getting enough blood flow while they're resting, but not enough blood flow if they're being more active. This is why one of the early signs of heart disease can be people having chest pain when they're more active, when they're walking upstairs or trying to run or exercise. And then in this last version of the blood vessel, you can see the plaque has gotten so severe that it's very much restricting the blood flow. And at this point, it can lead to clot formation, which can totally cut off the blood supply. If the blood supply is cut off, the tissue downstream is not able to get any oxygen, and this can lead to tissue damage and tissue death. If atherosclerotic disease is affecting the coronary blood vessels in the heart, it can lead to a heart attack. If it's affecting blood vessels in the brain, it can lead to a stroke. If the atherosclerotic disease is affecting the blood vessels in the leg, it can lead to peripheral artery disease. This can cause something called claudication, where people have trouble with pain when they are walking. Eventually, it can get bad enough that people may require a bypass surgery or even an amputation. And then atherosclerotic cardiovascular disease can also affect the aorta, which, if you remember, is a big blood vessel which carries the blood away from the heart to the rest of the body. This blood vessel is so big that the process is a little bit different. It doesn't actually get narrowed, but the atherosclerosis can cause damage and weakening of the blood vessel wall, which is under high pressure, and this can lead to ballooning out of the artery, which is called an aneurysm, and eventually this can get bad enough that it can lead to rupture, which is catastrophic. Now we're going to move on and talk about some of the factors that can put us at risk for cardiovascular disease. Cardiovascular risk factors come in a few different categories. The first is demographic. This includes age, as well as genetics and family history. There are also medical conditions that can put people at risk for cardiovascular disease. These include things like high blood pressure, high cholesterol, diabetes, and obesity. There are also lifestyle factors that can contribute. These include diets that are high in saturated fat and sodium, lack of physical activity, high alcohol intake, and smoking. The good news is that with the exception of the demographic factors, all of these risk factors are modifiable or controllable to some extent. So we have the power to lower our cardiovascular risk. Let's move on and talk about how we can lower cardiovascular risk and hopefully prevent cardiovascular disease. The American Heart Association has a helpful framework for thinking about this, which they call Life's Essential 8. And the Essential 8 are quit tobacco, get healthy sleep, eat better, be more active, manage blood pressure, control cholesterol, manage weight, and manage blood sugar. And we're going to move on and break these down one by one. Smoking is a major risk factor for cardiovascular disease. Smoking increases the risk of heart disease and stroke 2 to 4 times compared to that of not smoking. And the increased risk is there even with fairly minimal smoking, under 5 cigarettes a day, as well as with exposure to secondhand smoke. The good news is that that risk drops pretty quickly after somebody stops. So after 1 to 2 years, the risk of heart attack drops sharply. After 3 to 6 years, the added smoking-related risk of coronary heart disease drops by half. After 5 to 10 years, the risk of stroke decreases, and by around 15 years, the risk of coronary heart disease is close to that of somebody who had never smoked. And quitting smoking can be very challenging. It takes most people several attempts before they're able to do it, but the good news is that most people who want to quit will eventually quit successfully. And on the right-hand side of the slide, I've listed some resources which can be really helpful if you're trying to quit smoking. 1-800-QUIT-NOW is a phone number, and smokefree.gov are a website that can connect you to phone coaching, text message-based coaching, and apps that can be helpful for quitting. It also can be really helpful to talk to your healthcare provider and work with them to come up with a strategy, which may include some medications which have been shown to be useful in helping people stop smoking. Nutrition can be a very complicated and confusing area because it feels like the recommendations are constantly changing. That's why I really like this quote by food writer Michael Pollan, because it's very simple and it contains 90% of what you need to know. It says, eat food, not too much, mainly plants. So what exactly does that quote mean? Let's break it down piece by piece. The first is eat food. Eat food reminds us to eat more whole foods and less ultra-processed foods. A good definition for ultra-processed foods are foods that contain ingredients that you wouldn't find in a home kitchen. And ultra-processed foods are high in chemical additives and preservatives, and they also tend to be very high in salt, fat, and sugar, which we know help increase the risk of cardiovascular disease. Not too much reminds us to be mindful of portion size. American portion sizes have gotten a little bit out of control, and it's not infrequent that you might go to a restaurant or buy some food and the portion size that you're getting is 2 to 3 times what we should actually be eating. So a good way to try to address this is to use smaller plates. People using smaller plates will serve smaller portions without even realizing it. You can also try to pre-portion snacks by putting a reasonable amount into a smaller bowl or bag instead of eating it right out of the container. And when you go to restaurants, which you know are serving really big portions, one strategy is to try to eat half a portion, either by sharing it with a dinner companion or by having them box half of it up to take home to eat another day. Mainly plants reminds us that we should be eating a wide variety of vegetable, fruits, whole grains, nuts, and beans. Plants include a lot of healthy fiber as well as vitamins and nutrients that are good for us and help reduce the risk of cardiovascular disease. One rule of thumb that I like to use here is to try to fill half my plate with vegetables and fruits at every meal. And a corollary to that, if you're going to fill half your plate with fruits and vegetables, you also have to fill half your grocery cart with fruits and vegetables. As far as physical activity, the recommendations are that everyone get at least 150 minutes a week of moderate intensity exercise. Moderate intensity means a level at which you could still hold on a conversation, but you wouldn't be able to sing. And 150 minutes a week is the equivalent of about 30 minutes 5 times a week. So it would be 30 minutes most days of the week. The recommendation is also that in addition to that, we do moderate to high intensity muscle strengthening activity at least twice a week. And that could be lifting weights, or it also could be body weight exercises like planks and squats. There's some tips for trying to do this consistently. One is to find a form of movement that you enjoy. Walking can be a great exercise for a lot of people because you don't need much equipment. You can just lace up your sneakers and head out the door. But if you love swimming or dancing or playing tennis, just find something that you love, because if you do, you're much more likely to stick to it. The next tip is to make it social. If you are active with a friend, it makes it more fun, and it also builds in some accountability. And if you're a person who finds it challenging to exercise because of time limitations, you can also try doing it in smaller chunks. So instead of exercising 30 minutes all at once, you could try to build in 10 minutes 3 times a day. The recommendations for healthy sleep are that adults should aim to get 7 to 9 hours of sleep a night, which is much more than many of us get. Poor sleep negatively affects blood pressure, blood sugar, weight, stress, and inflammation, all of which can contribute to cardiovascular disease. And one common sleep disorder, sleep apnea, is known to increase the risk of high blood pressure, stroke, coronary heart disease, and heart failure. So some tips for getting a good night's sleep. The first is to stick to a consistent schedule. Try to go to bed and wake up at the same time every day. Avoid screens, caffeine, alcohol, and heavy meals close to bedtime. And try to get natural light and exercise during the day, ideally in the morning. And talk to your doctor if you have any signs of sleep apnea. Signs of sleep apnea include loud snoring, pauses in breathing while sleeping, and excessive daytime sleepiness. Now we're going to move on and talk about blood pressure, blood sugar, cholesterol, and weight. For all of these, there are some important numbers which you should know and understand, and some additional dietary recommendations which can help get and keep those numbers under control. However, for some people, the dietary changes aren't going to be enough, and you'll need to talk to your doctor and potentially take some medication in order to adequately control these conditions. So let's start with blood pressure. If we're looking at blood pressure, the important number to know is the blood pressure, and this is made up of 2 different numbers. On the top, that number is called the systolic blood pressure, and that is the pressure in the arteries when the heart muscle is contracting. And the bottom number is called the diastolic number, and that's the pressure in the arteries when the heart muscle relaxes. So a normal blood pressure has a systolic or top number that's under 120 and a bottom or diastolic number that's under 80. It's considered to be elevated blood pressure if the top number falls between 120 and 129 and the bottom number is less than 80, and it's considered high blood pressure or hypertension if the systolic or top number is 130 or more and the bottom number is above 80. Reducing dietary sodium can help improve blood pressure, and the majority of the sodium that we take in is in the form of salt. The goal is to take in less than 2,300 milligrams of sodium a day, which is the equivalent of around 1 teaspoon of salt. And this includes not just the salt that we add from the salt shaker, but also the salt in all the foods that we're eating over the course of the day. And it turns out that more than 75% of the salt in the American diet comes from processed and restaurant foods. So some tips for improving your sodium intake. First, limit processed and prepared foods which are so high in sodium, especially the American Heart Association Salty 6, and these include bread and rolls, cured meats, canned soups, sandwiches, pizza, and burritos and tacos. When you are going to eat those processed and prepared foods, read the nutrition labels to keep track of how much sodium you're getting in, and also to hopefully choose lower sodium options. Prepare your own food as much as you can. When you cook, you have control, and when you are cooking, you want to add flavor with herbs and spices instead of salt. When it comes to blood sugar, there are a few different numbers which you might come across. The first and most common number is the hemoglobin A1C. This is a blood test that looks at your average blood sugar over a 2 to 3 month time period. You might also see a fasting blood sugar number. That's a blood sugar after not eating for 8 to 12 hours, or the glucose tolerance test, and that's a blood sugar that's checked after drinking a special standardized sugary drink. And all three of these numbers are used to determine the risk and diagnosis of diabetes. So the normal range for a hemoglobin A1C is under 5.7. For the fasting blood sugar, it's 99 or lower. And for the glucose tolerance test, it's 140 or lower. The next range is called the pre-diabetes range. So these are people who don't have diabetes yet, but they're at risk for developing it. An A1C of 5.7 to 6.4 falls in the prediabetes category, as does a fasting blood sugar between 100 and 125, and a glucose tolerance test between 140 and 199. And then the diagnosis of diabetes is made if someone has a hemoglobin A1C that's 6.5 or higher, a fasting blood sugar of 126 or higher, or a glucose tolerance test of 200 or higher. There are a couple of dietary changes that you can make which can help manage your blood sugar. The first is to minimize added sugars. And here we're not talking about naturally occurring sugars that happen in foods like fruits and dairy products, but in sugars that are added in food processing. And the recommended daily added sugar limit for men is to keep it under 9 teaspoons of sugar or 36 grams of sugar. And for women, it's to keep it under 6 teaspoons of sugar or 25 grams of sugar. And most Americans are blowing past these recommendations. The average American takes in a whopping 17 teaspoons of added sugar a day. These added sugars are found in a wide variety of processed foods, so they're found in some things that you might expect, like desserts and sugary sodas, but they're also found in foods that are marketed as healthy, including granola bars and breakfast cereals, as well as in some surprising places like pasta sauces. So some tips for trying to decrease the amount of added sugar in your diet. First, just try to eat more whole, unprocessed foods that only include the natural sugars. Also, when you are going to eat the processed food, really pay attention to that added sugar line on the nutrition label. It's usually given in grams, which I personally think is kind of confusing. So what I like to do is to convert that into teaspoons. And because 4 grams equals 1 teaspoon of sugar, if you take the gram number and divide it by 4, you'll get the number of teaspoons. And I think that gives you a more accurate representation of what you're really getting in there. Rethink your drink. You don't want to drink a ton of added sugar in the form of sodas or fancy coffee drinks. A lot of those will include more than your daily recommended amount of sugar, believe it or not. And if you're craving something sweet, try fruit instead of something that has added sugars in it. The other dietary change that you can make that can really be helpful with blood sugars is to try to increase your fiber intake. Fiber slows digestion and limits blood sugar spikes after eating, and fiber is found in a wide variety of vegetables, fruits, whole grains, beans, nuts, and seeds. For cholesterol, the numbers that you'll want to look at are usually included in the lipid panel, which is a blood test that doctors will order periodically. This can be a really complicated area, but there are two main numbers that you want to be aware of, the LDL cholesterol and the HDL cholesterol. The LDL is considered the bad cholesterol. For this, lower numbers are better. The LDL carries cholesterol from the liver to the rest of the body, and if the levels are high, that's when we start to see buildup in the artery walls in the form of plaque, which can lead to the narrowing that we talked about earlier. The HDL is known as the good cholesterol. For this, higher numbers are better, and the job of the HDL is to carry cholesterol from the body back to the liver where it can be removed. What are appropriate levels for this depends a lot on your age and overall cardiovascular risk. So these are numbers that you want to talk to your doctor about to figure out what levels are appropriate for you. In order to control cholesterol, you want to be aware of your fat intake. Fat comes in a few different categories which carry different cardiovascular risks. So the first category, which you want to try to lose entirely, are trans fats and hydrogenated oils. These are fats that are commonly found in fried foods, packaged baked goods, and other highly processed foods. They're associated with increases in the bad LDL cholesterol and are associated with increased risk of heart disease. The next category, which you want to try to limit, are saturated fats. These are found in fatty meats, full-fat dairy, and tropical cooking oils like palm oil and coconut oil that are solid at room temperature. These also are known to raise the LDL or bad cholesterol and increase the risk of heart disease. The third category, which you are encouraged to have at least some of in your diet, are the unsaturated fats. These are found in fish, nuts, seeds, tofu, edamame, and plant oils like canola oil and olive oil that are liquid at room temperature. These can lower the bad LDL cholesterol and triglycerides and decrease the risk of heart disease, and can also provide essential fats that your body needs but can't make itself. As far as managing weight, one helpful number to know in addition to your actual weight is your body mass index. The body mass index is a calculated measure of weight relative to height, and you can calculate it online. I've listed a CDC website here that you can use, but if you just type in BMI calculator to any web browser, you'll find lots of online options that you can use. BMI can be an imperfect measure, especially if people have very high muscle mass, like a bodybuilder or a football player, but it is a really helpful indicator, and it's what's used to determine whether people are eligible to take weight loss medications and also undergo weight loss surgery. So if we look at the BMI categories, a healthy weight range, the BMI falls between 18.5 and 25. It's considered underweight to have a BMI less than 18.5, overweight to have a BMI between 25 and 30, and obese if the BMI is over 30. If you're trying to manage your weight, you want to pay attention to the balance between calories taken in the form of food and calories burned through physical activity, because that balance affects your weight. If you're taking in more calories than you're burning, that leads to weight gain. And if you're burning more calories than you're taking in, that leads to weight loss. There are a few different ways that we can affect this balance. So on the decreased calorie intake side, some ideas are to try to eat smaller portions, avoid snacking and going back for seconds, trying not to drink a lot of your calories. So you should make water your go-to drink, and if you're a coffee drinker, choose black coffee instead of fancy coffee drinks. And also try to eat foods that are high in fiber, because those will help keep you full and satisfied. And on the calories out part of the equation, you want to try to increase the number of calories burned, and the way to do that is by increasing your physical activity. Another really important part of cardiovascular disease prevention is getting regular checkups with a healthcare provider. And this is important for a few different reasons. First, it allows you to get routine screening, which would include checking numbers like the ones that we've been talking about, including blood pressure, hemoglobin A1C or fasting blood sugar, a lipid panel, which would include the LDL and HDL cholesterol, as well as a BMI. And then you can talk to your doctor about your numbers and what they mean for your health, and also discuss individualized prevention and management strategies. Everyone has their own unique challenges and preferences when it comes to their health, and it can be really helpful to talk to your doctor about those and come up with a plan that is best for you. And in some cases, even with your best efforts at diet and exercise, it may not be sufficient to adequately control those risk factors. And in that case, your doctor can work with you to get you on medication that can help control those numbers and minimize your risk for cardiovascular disease. We've talked a lot about how to decrease individual cardiovascular risk. Now I want to shift and talk about some ways that we can help prevent cardiovascular disease in our communities. The first is to lead by example. Maintaining heart-healthy habits can inspire others and create a ripple effect in a community. Also, share and educate. Talk to family and friends about cardiovascular risks and prevention strategies. You can help organize heart-healthy activities. Things like walking groups, cooking classes, and stress reduction workshops can help build healthy communities. And also advocate for change by supporting policies for things like healthcare access, healthy food access, public parks, sidewalks, and bike lanes that make healthier living easier for everyone. This concludes today's presentation. Thank you very much for your time and attention. I hope you've learned some things that you can take into your daily lives and your communities.